Hello and welcome to the Alive podcast. I'm your host Dimple, and today I'm going to dive deep into a topic that is really close to my heart: women's health and wellness. With the many challenges women face, both physically and emotionally, it's crucial that we continue to have such open conversations that empower and uplift them. Today, I'm honored to be here with a true expert in this field, Dr. Sunita Tandulwadkar. She's the director of Solo Clinic IVF and the chief of the IVF and OBGYN department at Ruby Hall Clinic. Dr. Sunita, it's such a privilege to just share the same space with you today.
Thank you so much, Dimple. It's honored to be with you. Thank you.
So, Dr. Sunita, in this fast-paced world that we live in, many women are finding it very difficult to prioritize their health. So, if you had to give them like just one modern wellness key that will help them to make a difference in their lives, what would it be and why?
See, it's not only the modern woman today working under stress, 24/7 busy with multiple activities, but the longevity of life has also increased.
Yeah, that's true.
So if I have to give one advice, can I give you two?
Absolutely, the more the merrier.
Diet, exercise, and weight control is my first. They should be very careful about what they eat because it's very important. It's not only for the weight, but their body's immunity also is equally important. When they do exercises, it's not only for maintaining their shape, but the bone health, which is so important, and exercise will help them to get the bone health right.
True.
Now, today's world is very much advanced technologically and understanding the body elements.
Correct.
We know which are the elements which are decreasing as we age and which are needed for your heart, for your bones, for your immunity, for everything.
Correct.
So there is a huge compartment of a regenerative medicine or a preventive health. So I know that I probably, even if I'm fit, my weight is normal, I'm doing exercises, still I'm going to degenerate every day.
Yeah.
Can I understand then, is there any therapy which will help me? My cells are aging, body is aging. What do you mean by cells are aging? The genetic component of the cells are aging.
Right.
Have you seen 20-year lady anytime having cancers or a 20-year boy? Not necessarily.
Correct.
But as you age in your 60s or late 50s, the cancer can come up. Why? Because it's not only the immunity of your cells, but the genetic component of your cells are also aging.
Okay.
And that's why the cancer cells, they are dormant in your body.
Yeah.
Your strong cells don't allow them to overcome with their power.
Right.
But as we age, as our cell age, the genetic component weakens. When they multiply, try to work, they're not as healthy genetically, and that's why these dormant cancer cells can come and attack. So you don't hear cancer of the bladder at the age of 20, 30, but it is very common later. Is there anything I do? Means I may not have a genetic predisposition for the cancer, but what can I do to make my genetic very normal? I need to make my every cell, the powerhouse of the cells, very strong.
So that they can fight it.
The powerhouse of the cell in our science, we call it as a word mitochondria.
Okay.
They are very important power cells. So there is one therapy called NAD+, NAD+. Many people call it with a different name. That therapy can help you to boost your cellular energy. That can help you to prevent or to slow down the aging of the cell in a genetic way I'm talking about.
Right.
So it's very, very important. Otherwise, this NAD is present in your body. When you are young, it's in a good power in every cell. As we age, the level of them decreases.
Okay.
So there are many women who takes the oral tablet. Is that sufficient? I have no answer. Because when you take anything orally, it undergoes metabolism into the liver. How much it goes into absorption and how much it goes into the cell, we don't know.
Right.
But if you take a IV therapy of this, NAD IV therapy is available. I know this drug is not available in India, but we can import those.
Right.
We can outsource those. And Alive is the one, probably the pioneer in NAD plus.
Absolutely.
So when I have my international patient coming and asking, do you have NAD? Because they have a knowledge.
Yeah.
In
the
US,
West, yeah.
Western countries, these things are easily available. They take it routinely. But our Indian women, they have equal right to be healthy.
Absolutely.
They have
yes.
equal right to be knowledgeable, approachable, and they need to know how can they remain healthy in their fifth, sixth decade of a life.
Yes.
So through the regenerative medicine or the preventive medicine, there is a lot, Dimple. Sometimes we can think about talking it at a length about regenerative medicine.
I think we will be tapping into this topic in further detail in one of the podcasts, because it's a topic that also has caught my attention. The West has already adopted it.
I think more than a woman, the doctors who are listening to your podcast, I don't know whether you have a doctors also as a follower, but if they are also listening,
it needs to reach far and wide.
They will understand that their patients will come and ask them the questions. Better they will read about this.
Yes. Very true. That's a really key aspect, and I think for the modern woman, it's a fast solution. You know,
it's
and
not
very
only
effective.
Modern woman, Dimple.
Everyone.
Everyone. Because as a gynecologist, for us, every woman counts. Every life counts.
Yes.
So whether it is from rural area, whether it is from urban area, whether from a rich society, poor society, every lady need to be very healthy and strong.
Yeah. So that's a key takeaway for us. Thank you. Moving on, one of the other important topics you just mentioned about health and take care of your muscles and the kind of degeneration we go through. So I'm coming to the topic of perimenopause. You know, it's a topic that people are talking about. It's a phase which is very overwhelming for women, and it's time to educate people about this. So what should we be mindful about during the transition in this particular period of our life?
See, what is transition? It means your ovarian hormone, the estrogen, which is so important for a lady.
Yeah.
Which is produced in ample amount in your reproductive health.
Correct.
Maybe from age till your menopausal age. Now, when you have a transition, it means the estrogen is not working in your body.
Okay.
It is getting lower and getting disappeared. And that transition is called menopause. Now, if you see, PMS is a very common word, premenstrual syndrome.
Yes.
Why that happens? Because ovaries are working very hard.
Right.
And the hormones are working beautifully. So PMS is a good sign actually.
Yeah.
You are ovulating, your hormones are good. Now, this estrogen protects your heart. It protects your bone.
Okay.
So if it is not there, you are tend to have problems with your heart.
Okay.
If you have not taken care of your weight and exercises properly, probably other chronic diseases like blood pressure, diabetes might attack you. And estrogen is very important for the health of a bone. So perimenopausal woman has to be careful with the bone health.
Right.
Again, that is a separate podcast one can think of.
Correct.
But how to improve? Is it only popping up the calcium? No. Because when you pop up too much of a calcium, you can invite the kidney stones. So nothing is, is going to be too good or too bad.
Yeah.
You need to have a balance.
Yeah.
So apart from diet rich in calcium, the most important thing one can do is exercises.
Okay.
The walking is the best exercise. Running may not be if you are not used to, but walking, brisk walking for 45 minutes is fantastic for your bone health.
Oh, wow.
So the lady should do their changes of osteoporosis, we call it.
Right.
Weakening of the bone. See, that's why if 10-year girl, she's playing on the ground, she falls, nothing, some injury on the superficial level.
Yeah.
70-year lady falls in the bathroom, she gets fractures.
Absolutely.
And sometimes it may be life-threatening because this can be complex fracture.
Yeah.
So every lady should take care of their heart, their diabetes, their weight, or their bone. But the most important also is their mental health.
Yes, that's become a key topic of conversation today.
And I'm happy that there are certain influencers or the film stars who are talking openly about the mental health. And just before I conclude, I should tell you, I'm doing a very big survey. Many of you are knowing I'm taking over as a president of our All India OBGYN.
Yes, congratulations on that.
Thank you. And one of the topic publication I'm doing is survey of mental depression in a perimenopausal age. So we are taking the woman from 35 onwards and we are trying to see how many are going. You will be shocked to see the percentage. I'm waiting for the result. By June end will come.
Wow.
It's a simple prevalence. Even you can. I should do one podcast with you for my this.
I am all about mental health.
All my surveys are for a common people.
Yes.
They don't need to go to the gynecologist. They just have to read the Google form, their age, their everything.
Yeah.
And if they are depressed, what is the level of depression? Right. 3-4 key questions we are asking.
Wow.
And in India, there is no such survey up till now. Right. We are coming out, and because we want to speak loudly about the mental health.
Yes.
And during this period now, see, the lady has taken care of her family whole her life. Her husband, her kids.
Yeah.
Today, when perimenopausal age is happening, she is going through certain mental disturbances. The family should come together
to support
and take care of her.
Yeah.
We call it as a TLC, tender love
and care.
So that's very important.
That's so beautifully
so
put.
Perimenopausal age, I know it's the most important age.
It is.
But
I feel like it's a second innings for a woman. Either she makes it or she breaks it.
Yeah.
You know?
But it will happen if the surrounding around her is positive. Then she will enjoy that.
Yeah.
And her own health is positive. She will enjoy.
I love the blend that you're bringing in this particular phase for us, which is physical and mental, because I think even if you're great physically, but if your mental state is not up to the mark, it's going to start affecting you.
You know, Dimple, I'm so happy. When my perimenopausal, now I'm 60, during my perimenopausal age, I was at peak of my practice. I never had a time to think, am I happy, am I not? What is happening around me? From 7 a.m. till 11:30, I used to be working, operating. So when this transition happened, I
don't
never
even
understood.
know. Fantastic. In fact, I must quote over here, Sadhguru had made an announcement last year that the biggest epidemic after COVID is going to be mental depression.
I agree.
And the fact that you've spoken about this, not only touched upon the topic, but you're actually doing something about it, I think is the need of the hour and something we all will see.
We are taking about 2 depressions. One is perimenopausal depression, and second depression I'm studying is postpartum depression. We are not understanding first 1 year after the delivery.
I've gone through it and I did not have the right support because I didn't even know a term like this existed that time.
So that is also when the lady frustrated, maybe it's a lactation, maybe lack of sleep, maybe lack of health, maybe her own career is going haywire because one live body is asking her for everything and time and all. So that period is also very crucial. I get a goosebumps.
Same. That's my condition right now.
So this is also postpartum depression.
Yeah.
We are working on that.
Perfect. You know, I think the other questions can wait because we've got a fantastic outcome today. We've spoken about some very, very important aspects that the women of India need to know. I think the West is still very much aware, and we're just struggling with baby steps in the awareness field. You know, let alone do things about it. And I hope everybody at the community of doctors will approach us and, you know, educate, empower themselves. The women who are watching this, I hope you get inspired to empower yourselves in all of this.
Yeah.
Any key final words that you would like to share with the audience as a takeaway from today's podcast?
Love yourself. Love yourself. The human life is a gift.
Yeah.
Every day, every second, every minute is important, and don't waste on a wasteful thoughts. Do something creative. I want to tell, India has a rich culture. We are somewhere following the Western culture. Please stop doing that. Take care of health. So don't have smoking, alcohol, habits. Do something socially. There are many people who need help. Do that instead of partying and wasting your valuable time.
Yes.
And at the end of a day, ask yourself one act which you have done something for others before you go to bed.
Wow, that's just so beautifully put. Thank you so much. I mean, in just few minutes, I feel like I've gained so much of knowledge and wisdom from you. Thank you so much for this. Really.
Keep on visiting Alive.
Absolutely. We have so much to talk about now.
Because now Solo Clinic and Alive has come together.
Yes.
On one floor. So anyone comes to Alive, I always get many of my patients who are in their perimenopausal ages now. I see them here with Rishi, and vice versa.
Yeah, absolutely. I think now this knowledge is going to spread to a far bigger audience. And thank you for doing this work in Amchi, Pune.
But I know. But you know what? I must say, it's not that Rishi is my son. This guy who is 10 years lived outside, double graduation, double masters, and no pressure from a family that you come back.
No.
And he comes back and he takes this regenerative medicine or preventive health to another level. I know as an endoscopic surgeon, I'm pioneer. As a stem cell therapy, I'm pioneer. The first one in Ruby Hall to start institutional setup for IVF. But my own family, my own child is pioneer in taking a preventive health to another level is a very proud moment. And I feel more than just, he is looking it in a very spiritual way.
Yeah.
Helping the generations to move on strong with your health, with your mental status. See, if I'm healthy, mentally I'll be happy.
Absolutely.
If I have a pain here and there and every now and then I cannot walk, I will automatically be unhappy, whatever money I have.
Yes.
So somewhere I feel very happy that this preventive health is a new concept he has come out, and probably the only one in the country where IV therapies, stem cells, regenerative, cellular fraction, all is
in one place, like it's a holistic approach. Yeah. No, in fact, I'm going to ask Rishi this question in my podcast with him because he could have chosen to be in the West and get faster success, so to say, where they've already adopted all of this, but he still chose to come back.
See, for success, I always believe you climb up the staircase. There is no elevator to success. No. The faster you go down. But money aspect, yes, probably he would have been. But I think happiness, what you are getting, that you are helping the people to be healthy. This is. And I definitely feel the second advantage for Alive is we have, because of my friend circles, board of doctors with us.
Correct. That was very
so we
important.
have orthopedician, we have physician, we have a neurophysician. So group of friends at your doorstep to help you.
And all experienced individuals. Yeah, that really comes.
That is probably the positive blend of
that you're bringing on the table. Yes, definitely. So that was Dr. Sunita, and we had a beautiful time chatting with her, learning so much of wisdom. I hope you really feel empowered to take care of your health, at least from today. And wait for my next podcast, which is with Rishi.